Hey guys, alright, so today we're going to be talking about the Toxic Lady on Creepy Files. Alright, now the Toxic Lady was Gloria Ramirez. Alright, and she was diagnosed with cervical cancer. And on February 19th, 1994, which, if you guys remember, that's pretty weird because, Lisa Lam was actually, found on February 19th. That was in 2013. So, she was admitted to the emergency room in Riverside, California, because she was in respiratory and cardiac distress. Alright, now, she had this sort of garlicky smell, and she was sort of had this strange greasy substance all over her skin. And when the nurses were checking her out, they started to feel lightheaded, and a couple of them actually fainted because of this strange toxic stuff on her skin, and it was causing a lot of people to faint and feel really strange. Alright, now, a nurse named Susan Kane was the one that drew her blood, and when she drew her blood, she found that it was a very strange, there was little particles, very strange little, almost glittery little particles in it, and after doing that, she immediately passed out. Now, her blood sort of had this strange odor, too, and a couple of the nurses, smelled the blood and they immediately passed out from this smell. Now, because of all of the people that were passing out after coming in contact with the smell, they had to evacuate the whole hospital. This is how toxic this lady was. That they had to evacuate everyone that was in that hospital because of everybody was just passing out and having some severe problems after coming in contact with her, the smell of her blood and the substance on her skin. Now, about 45 minutes after she was admitted to the hospital, she died, and the cause of death was from kidney failure because her cervical cancer had metastasized, and so they took her to the morgue. Now, because of the how toxic she was, they had to do the autopsy in a sealed body bag. That's how toxic she was. Now, doctors say that the reason for this is because she was using a drug called dimethyl sulfoxide. And this is actually used to treat arthritis pain. Now, they say that this was the cause for the crystal-like things in her blood, and this was also cause for the smell of that stuff. And they said that it can also cause a oily appearance on the skin and sort of a garlicky smell. Now, they say that this is why, but it's not really, it doesn't really explain why it caused so many of them to pass out. They said that it was just because of the smell, and that because she just took way too much of that stuff, and this was the cause for all of the toxins. That's not really determined, say it is, but that's not necessarily true. I mean, we don't know for sure. It seems like the most likely thing, but it's still a pretty strange. People that think that it was like aliens or something, but I think that there's probably a more realistic thing. Maybe it was the drug that she was taking, the dimethyl sulfoxide, but it's still strange. The whole hospital had to be evacuated just because of her on dimethyl sulfoxide. So that is the case of the toxic lady. Now, they say it's solved, but who knows if it's solved. So I just thought I would include this. I think it's kind of weird that it was February 19th, same thing as my first creepy file with Elisa Lam. She was found on February 19th. I think that was kind of weird, but I don't know, coincidences, I guess. But, alright, well, I'll see you guys next time. Thanks for watching.